I'm going to go live now. Okay. So it says we are live now, yeah?
Mm-hmm.
Okay. I'm not sure if people have joined yet. But Wesley will double check that for me. Yet. But Wesley will double check that for me. Okay, cool. Good evening, everyone. It's a pleasure to have you join us on our session, um, the Viva Feminine webinar. This is actually our maiden webinar that will be hosting by Viva Feminine. My name is Felix Bomide. People call me Felix, and I'm the chief exec at Viva Feminine. And I've got on the call today Ada Adaobi Duru. She will introduce herself shortly, and I'll talk you through what Viva Feminine is all about. Viva Feminine is an all-in-one ecosystem that caters for the women's health, from reproductive health to sexual health to physical health, and a whole host of stuffs that we will be doing with Viva Feminine. We are looking to do an alpha launch of our MVP, which would include menstrual tracking, pregnancy tracking, ovulation, fertility, symptom tracking, symptom checkers, and wellness, and community inclusive of the telehealth towards our alpha launch in January 2026. And today we will be talking about what every Nigerian woman needs to know about breast health. Our moderator for this session is Roslyn. I'm going to also add her to the stage very shortly so she can moderate the session for us. But Hada, over to you. Please tell our audience a little bit about you and maybe any few bits and bobs that I've missed out on Viva Feminine. Thank you.
Thank you, Felix. Hello, everyone. Good afternoon, good morning, good evening, from wherever you are listening from. My name is Ada. I am a biomedical scientist. I currently work as the clinical compliance and safety officer at VivaFemini. Like Felix has said, VivaFemini is a comprehensive ecosystem just dedicated to women's health. Okay, and today we're going to be talking about what every woman needs to know about breast health. We are not just going to be talking about cancer, we're going to be talking about awareness, courage, and taking control of our bodies and essentially our future. Okay, I'm racing today. Please swipe on the slides. So thank you so much. And before then, I just want everybody to understand that at Viva Family, we believe every woman deserves knowledge, because knowledge builds courage encourages and brings hope. So breast cancer is not just medical, it is social and emotional. Okay. When one woman becomes aware, it's a it's a ripple effect, it influences an entire community. So today we hope to empower and not frighten anyone. This is just for everyone to be aware of what to do. Okay. So yeah, I'm going to start with the statistics. We all know that breast cancer remains Nigeria's silent crisis. It's the most common cancer amongst Nigerian women, and it causes over 16,000 deaths every year. Actually, Nigeria ranks ninth in the world for breast cancer mortality, which is a whole lot. And about 70% of women are diagnosed at the advanced stage, which makes it a bit more wicked. So this means that women don't find out until it's late, when treatment is more difficult. But early detection can change every single thing. Next slide, please. Okay, so Nigerian women are more vulnerable. Why are they more vulnerable? They're more vulnerable because there are lots of reasons that make our women face higher risk. One of them is late diagnosis. Many women get scared, never get screened or to see a doctor or see a doctor early. So they get to their diagnosis later, and early detection is key. Also, there's a thing of cultural stigma where some people hide their symptoms out of fear or shame. Okay, we have the environmental and lifestyle factors. pollution, our ever-changing diets, and our inactivity actually plays a role. Also, we have disparities amongst women. Women in rural areas, housewives, elderly women often have the least access to screening or information. And these challenges are actually real, but they can be solved by awareness and action. Rose, could you please swipe? Thank you, Rose. So we're talking about early signs, how to recognize it. We all know that awareness starts with knowing what to look for. When you know what you are looking for, you are aware. If you don't know what you're looking for, you're not aware. So you wouldn't know what to look for, right? So the key warning signs are a lump or thickening in the breast tissue, changes in the shape or the size of your breast, and discharge from nipples, especially if it's bloody. We also have some warning signs like skin dimpling, redness or rash around the nipples, persistent pain in a particular area. And in countries with strong screening systems, early detection improves survival to over 90%, a whooping 90% if we detect early. In Nigeria, survival is below 20, 30%, 40%. So that it's the survival rate is really low, and that's because we don't detect early. Most women don't find it early enough, and we need to change that statistic. Okay, that's what this webinar is all about, telling us about it so we are aware of it, and then we can start doing it. Just make it a habit. So, the next slide, we're talking about breast self-examination, BSE, and I like to call it our personal power. So it's your personal power. One of the simplest things to do, the most powerful thing to do is breast self cancer. Okay, it's private, it's culturally appropriate, it's free, it's something every woman, every Nigerian woman, every woman in the rural area, housewives, we could do it by ourselves, right? But we need to know how to do this. Studies show that over 60% of our Nigerian women actually know how to do it, but very few of us practice it. So it's not just knowing it, we also have to practice these things, okay? By checking your breast at least once a month, sometimes a few days after your period, or you give yourself the advantage of time anytime you feel is convenient for you, but make sure it's something that you can replicate. So if you're doing it on the 2nd of um, October, on the 2nd of November, you should check again, 2nd of December, and continue like that. Earlier detection means easy treatment and higher chance of survival. Okay. Next slide, please. I think we'll be talking about how to perform the breast self examination. It's really quite a simple thing. It's something that we can all do. Like I said, it just involves standing in front of a mirror, looking for changes in size, shape, skin texture of your breasts. You can also do it while lying down. Okay, you lie down flat and use gentle circular motions with your fingers just to feel your breast, just gentle circular motions. Something that is quite easy. You also have to do it while sitting because these are different positions you can use to do it. It's something you can do while sitting or in the shower. Just cover your breast area, check it, you know, with the parts of your finger, the ball of your finger, just check for lumps. And of course, the nipples, gently squeeze your nipples to check for any discharge or unusual change. Like I said earlier, the best practice is to do it on the same day each month. Some people like to do it before their period, some do it a day after their period, just to make it a routine and habitual. So we'll be talking about overcoming barriers. Yeah, many Nigerian women face barriers, and these barriers are beyond the medical ones. We have those that face mockery, those that face job loss, or even their family rejecting them after a diagnosis, as sad as it is, it's a reality. Other people believe that cancer is just death. And so they don't even seek help. They just already rule out themselves. And some even begin to take steps towards their death. But that's changing. We need to change that. When people share their real stories, we've heard of people that have survived cancer. When they share their stories, when they share trusted information, safe spaces where we can all have conversations, we can replace this our fear with hope. One of the ways to overcome this barrier is to break the silence, talk about it, speak about it. People are talking about it, people are surviving. We hear of breast cancer survivors left and right everywhere, and it's something that we can all do. We can survive these things. Okay, so speaking out is very important. And so, yeah, what Nigerian women can do today. Please, next slide. Yes. So, what Nigerian women can do, previous slide. Thank you. What Nigerian women can do today, what we can do to help ourselves, we should learn and practice breast self examination monthly. Know what's normal with your breast so that when something is not normal, you would be the first person and you would detect it early and easily. You would be the one to raise an eyebrow and say, no, this is not what I know about my breast. Something else has changed. Okay, then we could schedule examinations, go to the hospital, mammograms, especially if we're over 40 or you have a family history. There's someone in your family, say your grandmother, your mother, someone, an auntie that has had breast cancer. Always endeavor to go for mammograms, especially if you're over 40. Then a healthy exercise, a healthy habits. Always eat well. Try as much as you can to eat well. Avoid smoking and alcohol. And like we all know, exercise lengthens the lifespan. I keep saying it personally. That's my personal mantra. And yeah, build awareness. Talk about your breast health to your family. Talk about it in churches. Talk about it in the community. I have a colleague that also has a hair salon. And it was really impressive. One day, I went through her status and I saw that she was teaching the young ladies, that her students that are learning how to make hair and style hair. She was teaching them about breast cancer. I specifically remember that day, and I was so impressed. And I had to comment because it's a colleague that I don't really talk to all the time. We are cordial. I don't really talk to her all the time. But I just said, this is very wonderful because a lot of what is a mystery. It's like a dark thing around breast and breast health and breast cancer. And we are trying to demystify it. And VivaFemini is your trusted ally to demystify it. We want to create that awareness. Awareness is contagious, and it could be the reason another woman gets screened on time. When we continue this, when we create awareness, when you tell the other woman, the woman tells another woman, a ripple effect is created. We get to save women's lives. People people survive this easily. Okay. So now the next slide, please. Yes, like I said, it's a communal thing, right? So the fight is not just for only women. If you're a man, if you're listening here, please understand that it's not just for only women. Talk to that your sister, talk to your wife, talk to your friend, talk to your daughter about it. Community and health systems both play vital roles. Okay, community can help through the market and church awareness. These are very good places where you see a lot of women, clusters of women. Also, peer support network and survival groups. You need to have these groups and support networks. It helps a lot. And of course, the health system, we need to expand affordable screening, train healthcare workers to provide empathetic and stigma-free care. We use media, which is what VivaFemini is doing right now, and social platforms, our platforms for outreach to share information about this, create awareness about this. Okay, together, community engagement and system improvements will change Nigeria's story on breast cancer. Then we can change the story. We can understand that breast cancer is beatable. When there is knowledge, early detection and care, we can beat it. You deserve care. Every woman deserves care. Viva Family understands that. That's why Viva Family, we are here for you. Understand that every woman deserves access to screening and compassionate healthcare. Quotes compassionate healthcare. And it's Viva Family's framework essentially. And it all starts with you knowing your breast, spreading awareness, supporting one another. Remember that your health is your power. And whatever you do, please remember to take care of yourself, take care of your health, eat healthy, exercise well. So yeah, thank you very much for being part of this. This is what I have to say. If we have questions, I'm here to answer. Yeah, thank you. Over to you, Felix. Hello, can you guys hear me?
Hi, Ada, can you hear me?
Yes, I
I
can.
was
I can
speaking
hear
since
you.
you could hear me. Oh, okay, great. Yeah, thank you so much, Hada, for that lovely stuff that you've just told us now about breast cancer. And I'm also so reiterate what we are trying to do in Viva Feminine. We are strongly advocating for people. We are advocating for individuals who are struggling or who have concerns around cancer or breast-related issues, not just breast-related issues, but general health and wellness concerns as well. Our app would cater for bits around health information library, where individuals are able to come on the platform to get access to first-hand, reliable, vetted information by our different healthcare professionals that will be signed up on the platform. And amongst other things is our telehealth features as well, which will be connecting users directly to certified licensed healthcare professionals to receive the best possible care they deserve. Okay. And just to wrap up what Ada was also trying to say around breast cancer awareness, we know that this condition exists, but much more important is the solution that we're trying to offer. And at Viva Femini, our solution is multifaceted. The first solution is obviously the ability to be able to examine your breast to our platform, and as such provide that sort of health information to an healthcare professional to apologies if you're hearing a background noise. So to be able to get the sort of healthcare to be able to get the sort of consultation or the services you deserve and you require, that is what we'll be doing with Viva Family, particularly from our platform as well. So we'll be raising awareness, advocacy strongly on our radar. Viva Femini will continue to raise awareness around women's health, from sexual health to reproductive health to physical health to chronic disease management, amongst other things that we will be doing in Viva Femini. And the exciting news is that we are looking launch our app on January 12th, 2026. And we will be launching a couple of features as part of our MVP, which would include some of the bits I've mentioned, tracking the menstrual cycle. And just like Ada mentioned, signs we need to watch out for could be a lump in the breast. And some of these things are also associated with hormonal changes and all these things, which will you can track via our platform. You'll be able to track fertility, pregnancy, wellness generally. We will connect you with verified healthcare professionals, not AI. So yeah, we have AI integration in our platform, but our AI has direct human oversight. So our AI tool is basically to generate insight of what the users are putting to it, and it doesn't offer solutions. It only offers an insight based of the data that has been provided into it, and that data can be shared with verified healthcare professionals on our platform to be able to receive the best care that we know our women deserve. Also, through our app, you will be able to engage with a supportive women's community. This is super crucial. We know that women deserve, and rightly so, we deserve a supportive community, and that is what you can do via the Viva Feminine app as well. There are lots and lots of exciting bits that we'll be putting in Viva Feminine because we know that it is long overdue for our women to receive the care they deserve, and we are saying that we will handle this solution, or we will with these concerns head on by providing an African first app that caters for women right in the comfort of their home. They are able to track things around their health, around their behavioral health, mental health, and a host of stuffs, and also be able to speak with clinicians or healthcare professionals. Also have access to a very strong supportive community as well, where they could engage anonymously or discreetly, amongst other things. So yeah, I'm excited for what the future holds for Viva Femini. And before you go, on your seat, on your screen, or wherever you're joining us from, or whether to whatever platform you're joining us with, you will see a QR code. That is the QR code to join our waitlist and have early access and regular updates from us. Feel free to scan that QR code, put in your details, and we cannot wait to have you join us when we launch the product in January. There are lots and lots of perks for you. It includes early access and updates, premium accesses that is offered for free, and most importantly, also the ability to be able to be part of the group of folks. That's the group of people that join Viva Femini from the beginning. It is really exciting, and I can't wait for us to have this product right in your hand in the comfort of your home. I think I will stop there and I will take questions now. Thank you. Any questions from anybody? No? Okay. Well, thank you so much for joining us for speaking about what every Nigerian woman should know about breast health in the last 20 something minutes. And we are delighted that you've joined us online as well. If you join us via YouTube, thank you so much for joining us via YouTube. We're incredibly grateful for your time this evening. And we'll look forward to supporting every Nigerian woman, because that is our goal and that is what we are committed to, not just now, but for the foreseeable future. And we love you. We love every Nigerian woman. We love every woman out there, because our promise to you is that Viva Femini will stand right by you, right with you, right beside you, to ensure that you get the maximum health you deserve. We know that every Nigerian woman should be treated with courtesy, dignity, respect, most importantly, be heard. And we are saying to you that Viva Femini, you will be heard and we will support you. Thank you so much for your time this evening, and have a fantastic evening ahead. Take care. Bye bye.
Bye. Thank you,
Thank you
Felix.
so
Bye,
much.
everyone.
Yeah. Bye, everyone. Bye bye.